Hello, hello. We're
Hi,
live.
guys.
Hi, everyone. So just want to, introduce ourselves here. So I know that we've kind of had some different people these last couple of weeks. I haven't been on actually in about 2 weeks, so it's great to be back with Casie. Actually, me and Casie, this is our first time doing this together. So just a brief introduction. I just want to say thank you everyone for joining in and presenting all these questions because we're really excited to be here and answer those from a peer perspective. Just to start off, so we are not licensed clinicians, Casie or I. We are coming from our peer experience. So we have OCD and we went through NoCD's ERP therapy just last year. So my name is Kyle and I'm a peer advisor here at NoCD, actually, as well as Casie.
Yeah, so we're really excited to come on and answer your questions. Just like Kyle said, we're not clinicians ourselves. We're people like you that have OCD. So we're, really excited to answer any questions or comments you may have. So yeah, as they're coming in, we can start answering questions.
Yes, we can. Hi, Aurelio.
I
Okay,
feel like mine is like,
so yeah, just waiting for
oh, I can change brightness. Yes, okay.
questions to stream in there.
All right.
Hello. Thank you so much for joining. Just going to kind of wait a minute or two to get some questions here. Do you see any on your end, Casie? I just want to make sure.
Just the two highs.
Okay, just the two hellos. Hi, Kelly.
Hi.
Thanks so
So
much.
yeah. Very cool. So yeah, as we're going through these, feel free to ask any questions that you guys think of. I know this month is Pride Month, so we would love to answer any if you guys have any sexual orientation questions. I know both me and Kyle are part of the LGBTQ community, so we can try to answer questions from that point of view as well.
Yeah, absolutely. I know that, OCD can be tough and coming out with OCD as well as coming out in general with, sexual orientation. So we're, of course, very, very happy to talk about that as well. Okay, so I see some questions streaming in here, so I'm going to throw some up now. Okay, so here we have our first one. So, hi, Annie. I hope I'm saying your name right there. So sometimes I feel scared to be alone, like my boyfriend left to work and I automatically feel depressed because of my OCD. Is this normal? I think so. Yeah. I think that it's hard to say what's normal with OCD. I think that there's so many pieces and parts, and I think it does depend on compulsions. And sometimes I know with OCD, people may feel better while being around other people, or they feel better being on their own. So this might be a situation where maybe you feel safer with your boyfriend there. So I do understand that because it's kind of like that support system. So I'm sorry that you are feeling that way. What do you think, Casie?
Yeah, I would say the same thing. I noticed personally myself in the past that whenever I was alone, I had less distractions to keep me out of that spiral that we get ourselves in. So I would say, if that's something that you notice, that that's a trigger, that, that's a time where you know that your emotions are going to come out whenever he leaves. I would try to, I know personally what I would do is I would try to prepare things to do so that when I knew that time was coming, I could counteract that depressed feeling, stopping myself from getting in that downward spiral that we find ourselves in. But it's definitely, it's hard to say what's normal with OCD, as I'm sure we're going to get a lot of those questions, and rightfully so, because I used to ask them myself all the time, is this normal what I'm doing? But it's definitely something that's common, and I think that it's something too that becomes easier throughout treatment is finding that time, like Kyle said, if you benefit more when you're with people or when you're not with people, those hard times become a little bit easier as you learn to manage.
Yeah, absolutely. Yeah, it's almost like an exposure. So exposures can be tailored to this type of thing of a fear of being alone or a fear of being around people. So yeah, I'm sorry you're going through this, but we're here for you. All right. Hi. Lots of highs. Hello, everyone. Hi, Kayla. Okay. Oh, I lost my place here. Let me grab another. Okay. So here we have a question here. Hi guys, wondering if you've heard anything about the use of EMDR for OCD. I have not myself. I've heard of the term, but I truly don't know much about it. What about you, Cassie?
I actually haven't either. I'm looking up right now. Um, I don't even know what EMDR stands for, which is terrible.
I've heard of it, and I think is it something like is it like electromagnet something? I think, but yeah, we I guess from this we do not we don't know much about it.
Oh, it's eye movement desensitization and reprocessing. I think it might be under the branch of no, I don't even think it is. It does seem like it's something that's been used for panic attacks and PTSD. I don't know of any form that it's been used for OCD, but they're literally always trying new things.
Mhm.
So I would be interested to see how this comes in the future. I know that, they're always letting out new research and such.
Yeah, I agree. I do hear things like kind of randomly in the mix of just like other, just kind of like studies that they're doing. So yeah, I mean, we'll see. But yeah, hopefully things will, there'll be new things that could help more. So who knows? Okay. All right. So Bella, how do I deal with OCD thoughts when driving? I think that people think I'm a criminal when I'm not, and that I am a weirdo. I avoid looking at other cars. I'll let you go first on this one, Cassie.
Yeah, so I completely understand that because I know that whenever my OCD is kind of flaring up or giving myself intrusive thoughts, I always did one of two things. I either asked for reassurance or I would avoid things like the plague. So I totally get how you feel whenever you're driving and it's hard to deal with those intrusive thoughts that are causing you to avoid looking around and doing other things. I would treat it like an exposure, honestly, because you don't want your OCD to get in the way of you driving, and you want to make sure that you're driving safe. So even if you're not staring at every car that's passing by, maybe sometimes if you're driving, tell yourself, I'm going to look at one car, or I'm going to, try to look at somebody and think, I don't know what they're thinking, but I can live with that. And try to slowly expose yourself to that feeling.
Yeah, it's a lot of uncertainty there. So it sounds like, yeah, to expose yourself to some uncertainty or to try and acknowledge that there is uncertainty there. But if you aren't in therapy, this is absolutely something that you could get exposures for. So I mean, there's many different types of OCD that I know revolve around driving and can make it very difficult for people. And I know some people do stop driving as well, which I know they don't want to. And so that's a goal for them to get into therapy to get better so that they can get back into driving and feel comfortable in that way. So if you aren't working with a specialist, Bella, I would definitely look into it because um, OCD can evolve, and it's best to be proactive and when you feel ready. But I'm glad that you're joining in and asking questions because this is scary. So just know that yeah, we're here for you, and you like Cassie said, it's like a slow exposure, but
Mhm.
exposures are also something that you really learn in ERP therapy by a specialist. So that's also something that would really help. Okay, this Cassie.
Suffering with relationship OCD, any advice? So this is one of my subtypes that I struggle with. For anybody that doesn't know, it kind of revolves around getting intrusive thoughts, a lot of doubting with your relationships, mostly with your significant other, but this can affect other relationships like friendships with your family. Um, and I will say that the biggest thing that helped me with this was getting educated on it, because as much as our intrusive thoughts suck, which they do, I think it makes it a lot worse whenever we don't know what we're dealing with and we don't know that this isn't our thoughts.
Mhm.
So, I used to get intrusive thoughts that I didn't really care about my significant other at the time, or that I was with the wrong person. Sometimes it would affect my friendships where I would get intrusive thoughts that my friends didn't really care about me, or, just things like that that are really awful to ruminate on. And from time to time, I still do get those thoughts, but it helps tremendously being able to, one, recognize that it's your OCD, and two, to sit with that feeling that, this might be true, this might not be, but, hey, that I can't do anything about that. And sitting with that feeling, that, definitely something that a therapist is going to be able to help most with your individual situation, but those are things that helped me.
Yeah, yeah, no, I love that. And that makes a lot of sense. And I like how you said that, like, typically it is with like a partner or, like in that type of relationship. But I do have it with my mom. So that's something that I have, and I don't really have it with other people. So it can definitely just be very different across the board. But yeah, Cassie, I do like what you said there. I think the hardest part is that that definition, like that line between like logic and OCD. And I
Mhm.
think it can be really tough in relationships, especially because I think that line can get really blurred sometimes. Because it's like, am I being logical about this because they said that, or am I just completely ruminating for hours over something that actually doesn't matter? So it's a tough one, Beth. But like Cassie said, I think kind of sitting down and getting educated and trying to identify what OCD is trying to tell you and what you truly feel. And that's hard, but to kind of sit there and try and separate that, I know can help. So okay, we got one from Facebook. This is Kelly. So I'm noticing that my daughter, who is ADHD and OCD, is struggling more with ADHD. Her OCD doesn't seem to be bothering her as much. Do you think she's growing out of it? She's 15. Well, what I would say, Cass, you were probably gonna say this as well, but like comorbid disorders. So I mean, that's something that yeah is huge. A lot of people who come into therapy are struggling with a few different things, whether that's generalized anxiety, depression, ADHD, OCD, PTSD. So typically, what happens, Kelly, at least when they come into no CD, what would happen is your daughter would have an assessment, of course, that first appointment, which is an assessment, and she would be assessed for other disorders as well, so not just OCD. And what it is up to the specialist is to determine which is stronger for her and which is influencing the other. And so if they did come to conclude that the root of the problem is ADHD and OCD is like what do you say is a side effect of that, then they may refer her out to specifically just ADHD therapy. So if OCD was stemming from ADHD, then it could be possible that it could, I guess, subside as ADHD is worked on. But I know it gets very complex there, and that's where the expert comes in. What do you think, Cassie?
Yeah, I think you made a really good point that, as treating one thing, something else might subside. That's normally what we say, anyways, when people come into therapy. If they have a comorbid disorder and something else going on, we usually suggest working on the more prominent one first, and then whatever's left of the other one, because sometimes they feed off each other. Another important thing, too, is that, OCD definitely comes and goes in people's life.
Mm,
Um, it comes out, I noticed just as myself, whenever I was little, I had OCD tendencies, but it didn't really, really flare up until I was going into college. So it could be that she's growing out of it. It could be that, it's calming down for right now. We don't really know. And that could be something to follow up with a doctor if it does come back.
yeah, yeah, no, you're right, Cassie, because something that we say all the time is that OCD ebbs and flows, or people say it in many different ways, like it waxes and wanes. It can drastically change, whether that's hour by hour, day by day, month by month. So, I mean, when I was struggling, when I hit my lowest, so I hit a low point with intrusive thoughts and OCD, and it really debilitated me for a couple months. And then all of a sudden, the thoughts were still there, but I wasn't as like debilitated by it. And I had a couple good months where I felt like, okay, I don't need therapy. Like I'm kind of overcoming this. I'm working through it. And then a month later, completely went downhill again. So it's very normal for OCD to ebb and flow like that. I do hope that it's maybe she's growing out of it, but definitely something to watch. All right. I'll let you read this one, Cassie.
Okay, recovery question from Chris. How do you both process the crappy or painful feelings that happen when we cut off compulsions? Um, so I guess I will answer this first. I still struggle with cutting off compulsions. There are definitely days I still do them, um, but I've gotten a lot better at it, and it it almost feels better when I'm able to cut them off, and I think that comes later on with recovery. It's hard in the beginning because you really, really just want to do that compulsion, and it's really hard. But the more you do it, and the more you continue to see results, um, it's almost like it fuels you to want to keep going
Mhm.
because you see who you can be without living by these rules that our OCD sets for us. So, whenever you get to that point where you don't depend on them so much anymore, then it's like, you're definitely still going to have slip ups here and there. I know I do. Nobody's perfect, but it's, it gets a lot easier to just part with it and say, I don't need to do this anymore. If that's what the question meant, I think that's what they were talking about with cutting off compulsions.
Yeah, yeah, no, I think you answered it really well. And I think, yeah, and you kind of said this in the beginning, but in a way, but it's like we get so used to those compulsions, it becomes natural for us. So when we stop those, the mind and body is like, whoa, what's going on? Like, why are you doing that? And that's where I feel like, yeah, those crappy or painful feelings come in because it feels unnatural for us to do that, especially if maybe if like we're still in therapy or right out of therapy because we're still really getting a hang on how to resist and also interject that in our everyday life and kind of get a flow with our quote unquote typical life, but also managing our OCD. So yeah, it can be tough. And so I would say when if I feel like I'm like leaning into a compulsion or something, I mean, I really do rely on all the techniques I learned. So I try to not let that like painful feeling sit because to me that could be like a little bit of like rumination. And so I try really hard to take that moment and use any techniques I can. And if I'm still feeling like really overwhelmed by not doing a compulsion, I have to do an exposure because I just have to. That's the only way for me to truly work through it. Because sometimes I can be like, well, I maybe I'll do tomorrow. I'll kind of see, but it's always in my best interest to do it right away. So that's kind of the way
Mhm.
the way I go about that.
True.
All right. Best advice to get over the fear of the pain of panic attacks.
I think this is a hard question to answer just right off of that. I feel like it's more personal because I'm not sure if you mean physical pain or mental pain. Um,
Yeah, or like maybe some trauma in there.
yeah, it's
Mm,
hard to say based on just this, and I feel like that does unfortunately require working with somebody who has experience with panic attacks. Um, I know personally from the few that I've had throughout my life, it's um, I didn't really have a fear of it because I didn't expect them ever. I didn't have them often enough that I could anticipate them. I know the last time I had a panic attack, I ended up going to the hospital because I thought I was having an asthma attack, and the amount of times I was hitting my inhaler was just making it worse. um, but it's I would say it's not something that is really easy for most people to anticipate. So I would maybe suggest working with somebody more closely with what you're going through. But if not, I would say maybe treat it as one of something that we do with OCD, which is accepting uncertainty. That we might not ever know when it's going to happen, but we have to trust ourselves that we can get through it.
yeah, yeah, that's what I was kind of gonna say is that I know for me, I had panic attacks like every day when I was at my lowest of OCD. That's what brought me into therapy because I couldn't even like go throughout my days really because I would just be like shaky and just like white as a ghost because I was always just very panicked. And and yeah, it was of course very scary and something that I've realized, and this is something that I've gotten just finally like I feel like a grip on is when I am feeling panicky. For me, it's like there's like one feeling that starts, and then it's like, oh gosh, why are my hands like getting kind of sweaty? And then maybe my thoughts are racing, and then I feel like, all that starts happening, and then the mind just goes like, oh my God, what's wrong? What's wrong? What's wrong? And but that's me trying to figure it out versus accepting uncertainty of, well, I don't know what's wrong. I feel weird. I feel anxious. I feel panicky. I don't know why, and that's okay. So that's something that I do now, because it's like OCD. I'm feeding it. If I'm like, why is this? I got to figure out like why I'm anxious. Did I drink too much tea? Is it this? Is it that? And it's the same thing of rumination. It doesn't really get you anywhere because you feel what you feel. So it's been a lot easier for me. And I've been practicing a lot. I really got to purposefully and intentionally stop myself in that moment and say, you're feeling panicky, like reel in my rumination and just say, it's okay. It's okay that I'm feeling panicky. I've felt panicky a million times in the past. It's always been fine. Like, I got this. So I give myself little pep talks now, especially with those, because it is scary. And I think the second that panic feeling starts, it just can like skyrocket in a second. So I got to like stop myself right when it starts and just be like, it's okay. I feel this way. It's fine. That's all right. And I think we try to run away from a lot of those type of feelings, but we're allowed to feel panicky. We're allowed to feel anxious. So sometimes it's just telling yourself that it's okay to feel that way.
That's a really good point. I know that, like whenever my OCD flared up or I got triggered, I would get like this knot in my stomach, or like I would like get tunnel vision really bad. Like I need to focus on whatever this is. But yeah, I know a lot of people do get panic attacks a lot of times whenever they get triggered. So that's some really good advice.
Yeah. No, yeah, thanks. And it's just something that, you really got to be intentional on, because it's so easy, especially during those panic feelings, to just kind of like skyrocket right away. So I just tried really hard, and I might ruminate for 5 minutes before I catch myself, about like, oh my God, what's going on? Why do I feel this way? And then I try not to be too mad at myself if I don't catch it. It's just that when I do, that's when I can change it. Like, it's okay that even if you do it for an hour, but if an hour passes and you realize what's happening, that's your opportunity to change it. Yeah.
And that's a really good sign of recovery too, is that, in the past, and this is for anyone out watching too, if you're ruminating for 5 minutes, it's not fun, but in the past, you might have ruminated for like an hour before realizing it. So that's good progress.
Yeah, absolutely. All those like small steps, they're big steps actually, and we kind of overlook them. All right. Okay. So we have official gamers here. So has anyone had HOCD? So HOCD, used to be referred to as like homosexual OCD, which is now more so sexual orientation OCD, because there's so many different layers now to it. It's not just homosexuality. So that's just something, if you're all wondering, it's typically SOCD now, which is sexual orientation OCD. Just some education there, because that is a newer thing that's kind of changed over recently in the OCD world. But so has anyone had HOCD or sexual orientation OCD so bad to a point where you feel like you're emotionally numb and feel like reality is distorted? Have you?
I'm sure somebody has, if it's an anyone question.
Yeah. Oh yeah, absolutely. And I did have a moment of sexual orientation OCD, just a moment. And yeah, it was terrifying, and it really, really triggered me, and it was scary. And what I'll say is that I think with a lot of people who experience any type of OCD, reality gets distorted. I know for me, my reality, I just felt so lost. And how it's more so like depersonalization and disassociation is kind of what I associate to like when reality is distorted. You just feel completely like not grounded. But yeah, I feel like, yes, that's absolutely how people feel. And I'm sorry that you're feeling this way, but it's, this is something that can change if you are able to work with a specialist.
Yeah, and too, I think a lot of it has opened up for sexual orientation OCD. I know that's not one of my main themes, but it definitely flows a little bit into my relationship OCD. I remember specifically having a conversation at one point with another advocate in the community, Tori. I'm sure a lot of us know her, but I remember having a conversation with her because she's openly in the LGBTQ community too. And I was getting a lot of intrusive thoughts with along my relationship because I identify as bisexual, but I have not had the opportunity to date a girl yet. And I was having that feeling like, oh my gosh, am I in the wrong relationship? Is this not who I'm supposed to be? Am I messing up my future? All this stuff, like all those spiraling thoughts that, you know, we have. And she taught me a very good way to recognize it is for looking for that sense of urgency. Like you need an answer right now or something bad's going to happen. And the really beautiful part about the world that we live in today is you don't need to know your sexuality. You don't need to know, you know, who you want to end up with the rest of your life or who you want to exclusively, what gender you want to date, anything like that. So it's nice to have that permission to sit with that uncertainty, and we don't need to have all those answers. So that's something that, you know, for that brief moment I hit sexual orientation OCD, it was nice to get out of it. Oh no, did my thing die? Okay. But
Yeah.
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 Just a little advice from one person with OCD to another.
Yeah, absolutely. But we're here for you. If you are not working with a specialist, it can, I mean, it changed my life. Casie can probably say.
Yeah.
Thank
Yeah.
you.
The biggest thing that helped me, like I said, I will say it again and again, is getting educated and learning how to do ERP. It is something that it takes a specialist, I would say, to learn it, but they help you get to a point where you can do it on your own, which I think is very important for, as we say, OCD ebbs and flows. So when it does come back,
Yes, yes,
if
exactly.
it does, if.
If it does. Okay. All right, Stephanie, I'll let you take this one, Casie.
Sure. Is it normal for your OCD and intrusive thoughts to get worse when you first start ERP? This past week has been so hard for me with anxiety and thoughts. I just started ERP like 2 weeks ago. We hear this all the time,
Yeah.
all the time. And I think one really good, I don't want to say excuse, but I guess reason why you might feel this way is it's not so much that it's getting worse, but it's like all these things that we've suppressed for so long and not dealt with, we're kind of all of a sudden putting it out on the table. Like, here you go, we're going to work on this now. And a lot of times it's things that we didn't really ever want to think about. So it's kind of, it feels bad to all of a sudden be like, okay, now I'm going to start working on this. But you know, it does pass as you start to get you know, more used to it. I know personally for me, I was very cautious about opening up in the beginning, and that feeling kind of passed where I was like, okay, my therapist isn't judging me, she is taking me seriously, I can actually tell her about all this stuff. It kind of helped me start to ease more into therapy.
Yeah. Yeah. And yeah, Stephanie, I definitely would say the beginning is the hardest because it's like it's breaking a pattern. I don't know how long that you've struggled with OCD, but I know for many people, I mean, it's years or you know, whether or not though it's been months or years, I mean, we get into such a pattern and that's engraved in our brains. So as you're beginning ERP therapy, you're breaking that pattern that you've created for so long and have gotten so good at. So when you think about that, it does make sense that the beginning is the hardest and that anxiety can definitely spike. And also because I know my OCD was like, you know, kind of like, what do you think you're doing? This isn't going to work. This is just going to prove that like this is all real and this and this. And it's all, and those can be new intrusive thoughts because prior to therapy, I wasn't really thinking about that per se of like proving myself, you know, wrong or right. And so I think that there's a lot of ERP therapy is unknown. OCD hates unknown. So you going into this, it, you know, can definitely spike. So yeah, I would say just be patient with yourself and know that it's okay and it's a part of the process.
Yeah, exactly.
Okay, let me see. So Official Gamers, he mentioned, so we answered his question before about reality being distorted. He mentioned existential OCD as well. And that's actually what I thought about when you first asked your question, because I have existential OCD and that really distorted reality for me, especially with disassociation and all of that. So just wanted to say that there. Um, okay, so what is the best way to do exposure for contamination OCD with like poison? I know a lot of people use raid and other things like that daily, but don't even like being close to it since it's poison. So because we're not licensed clinicians, we cannot unfortunately give any type of exposure advice because there's a lot that goes behind that. I mean, you would be assessed. I'm not sure if you are in therapy right now, but there's an assessment and there's just a lot of things that go into this to create an exposure for you. And that's why it's very important to work with a specialist because they get to assess and help you identify these core fears and what could work the best for you. So we're not able to direct in that way, unfortunately. I mean, there's definitely many exposures that can be created for that. And the other thing too that is just kind of cautious, and that's why typically you want to work with a specialist is because you don't want to overwhelm yourself, and because that can just be it could be a lot. I know I try to do exposures on my own before therapy, and it did not go well, which I hear from a lot of people. So because when you start therapy, you get what's called a hierarchy. And so you start at the bottom, which is lower level anxieties for yourself, and kind of work your way up to those harder triggers. And so that's why there's just a lot involved there, and it's best directed by a specialist. Any other thoughts, Casie?
I think you really covered it all. I would just, encourage people to that have, I guess, contamination fears or other fears of things that, you don't really see yourself exposing yourself to poison because that's dangerous. That's an even bigger reason to seek help from a therapist because there's so many ways that you can do ERP without throwing yourself into the deep end, so to speak. There's scripts you can write. There's, you can create scenarios with your therapist. There's all sorts of different things that you can do. And, they're so creative with exposures. So, they can always help find something that's comfortable for you to do, but also going to trigger you a little bit enough that it's going to be working.
Yes. Yeah. No, that's great for sure. But good luck, Aurelio. I know it's really tough, but you got this. You do. Oh, my thing jumped. Give me
Oh, I
one.
can go to the next one if you want.
Oh yeah, sure.
Okay. A sufferer of ROCD here, just here for support and wanting to know that I am not broken for feeling the way I do. It is a very lonely feeling disorder, and we're not here to give reassurance to say you're not broken or anything, but it's nice to find a community because you realize that you're not the only one going through this. So I hope that reading these comments and being here on the video helps you find that sense of community to realize that, you might not be broken like you think.
Yeah, and I know I felt that way a lot. I think a lot of us do feel that way a lot, but we're in this together, Kaylin, for sure.
Wonderful.
Yeah, you can grab the next if you want, Casie. I didn't know you had the ability to grab them.
I know, I
You
pulled
used
that
to
out.
do it, and Tori was
Right.
the host. I wasn't able to, so.
I love all the positive feedback we're getting from
Yeah,
people. This really is the best sense of community.
it is.
Okay, Heisenberg says, "Hey, I'm suffering from OCD and I have extreme anxiety. Sometimes I feel like I'm going to hurt somebody one day. Should I seek a therapist or a psychiatrist?" So for anyone wondering, difference between them, psychiatrist is the one that prescribes medication. Therapist or psychologist are the ones that help with the behavioral aspect. So, OCD, it's different. Some people, medication is the best thing that helps them. Some people therapy. Exposure and response prevention is known to be the best form of treatment for OCD, but of course everybody's different. Personally, and I can't give recommendations on a clinical level, but personally, I would seek therapy from somebody who's clinically trained to treat OCD, like at an OCD. But I would say, especially if you have what sounds like harm OCD, they're going to be very experienced in helping with that.
Yeah, I highly agree there. Casie said it, ERP therapy is the most effective form for OCD. And I'll just say, I mean, many people, though, they have both. They'll have a psychiatrist as well as their OCD
Mhm.
specialist. And something that for anyone to know here, if you don't know, if you're coming into therapy with an OC specialist, you can consent to what's called the release of information, or ROI form. So what this does is it allows your OCD therapist to speak with your psychiatrist, so that you are in the best care, and both of your clinicians are on the same page, and so that they can collaborate and make sure that you are getting the best care. So I know a lot of people do both. So they'll do medication in conjunction with therapy. But one thing I want to say too is that medication can affect therapy and ability to do ERP and certain things like that. So it's just a big conversation, absolutely. But as Casie said, when it comes to OCD, I agree that it's best to go to an OCD specialist. But
Mhm.
that doesn't mean that medication won't help you either. So it's just more so like a personal discretion of what you feel.
True.
Okay, I'm grabbing one here. Okay. Sorry, I'm going through here. Okay, here we go. All right, Leah. I'm a parent of a teenager with OCD. I am a participant in my daughter's OCD. She's constantly seeking reassurance from me, and I give it to try to quiet her anxiety. I feel that I'm making it worse. I'm sorry you're going through this, Leah. I mean, I think that's one of the hardest positions to be in, when you are the parent of someone with OCD, because you're their parent and you just want them to feel better, because you love them and you don't want to see them suffer. But what's so hard with OCD is that that comfort can harm more, like you said, with the reassurance. And so, but I speak to parents a lot who really struggle with this of, they're like, I know I shouldn't provide reassurance, but it's 2 in the morning and we have to go to bed. There's certain things that, like, and they're like, I just have to, like, we have to, get it under control. And I think that it's very complex here. So I'm sorry that it's hard. It's really hard. Now, I would say, I mean, anytime you do give reassurance, it it's not helping the situation. What would you say, Casie?
Yeah, I would agree. And it's hard because as a parent, you want to tell your kids everything's going to be okay. You're not your thoughts. You're not, all of this. And that's something that I had to, have that discussion. My therapist had to have that discussion with my mom when I was in treatment, because she was the person that I would go to and ask for reassurance. And what's nice is that you can learn other ways to support the person that you love that has OCD and is going through treatment. Um, I know sometimes my loved ones, now that they know what reassurance is and they know what me checking is or doing compulsions, they can kind of give me a friendly reminder like, hey, you can walk away from this. You do not need to, you know, give into these compulsions. And it's kind of like in my head, I'm like, I know, I really want to, but and then I think you're right. I can walk away from this. I can stop doing this. Um, and there are some days where I'm like, I really wish you'd give me reassurance, but then at the end of the day, I know it's better that they're not. So there's other ways that you can support them rather than um, giving them reassurance or trying to give a temporary fix, so to speak.
Yeah, but best of luck, Leah. It's tough. So I really do hope that, yeah, that your daughter gets better. And as she gets better, it'll be easier for you to not give reassurance, because hopefully she won't be seeking it as much.
Mhm.
But yeah, if she's not in therapy right now, Leah, I definitely would look into it. And I mean, no CD is truly wonderful. So okay, let's see. So this has been very confusing since the onset of my POCD. How do you deal with severe POCD in a relationship in terms of communication and intimacy? Yeah, this very, very hard. I do struggle with POCD myself, so I understand just those terrible feelings and thoughts that come along with it, and just how it can make you feel. So I'm sorry that you're going through that. That's actually how mine started, and then it morphed. But I think in a relationship, and that's tough. I mean, because that's something that I've thought about of because I've never been in a relationship while working through my OCD. So it's always something that I think about is when that does happen, how will I, what needs to be shared, what should be shared, like that type of thing. Because I think with OCD, I think there's lines with ourselves, like stuff that yes, absolutely, we can share and get that support. But there's also stuff that's just not necessary that, it depends on what we're comfortable with. So I think that there's a lot of personal discretion in there. And I think it also depends on what type of relationship you're in. Is it one where typically you are very open in your communication and that's well received? Is it typically hard to be open? Um, yeah, so I'm not quite sure. What do you think, Casie?
Yeah, it's hard to talk about, and this is definitely one of the most hardest themes to talk to people about.
Yeah.
Um, I was very fortunate that whenever it did happen, that I got triggered by something that fell under the umbrella of POCD. Um, I was comfortable talking about it, but even, me being somebody that talks about OCD every day, I still did not know how to approach sharing it with the people I wanted to. And it was extremely hard, but I know that I started out by showing them an article. We have really great blogs
Mm,
on our website, and I literally pulled up one that explained what POCD was, because I think that when people understand what POCD is, it makes it a lot less scary than it sounds for them. For us, it's still very, very hard, but it's hard for the reason that, it almost feeds off of our fears. Like, people with POCD would never dream of hurting a child or wanting to be a pedophile, but it's almost like our mind is taking that worst fear and spinning that forward for us. Um, so I think when people understand that that's what it means and it doesn't mean how it sounds, it changes the dialogue completely. And, you know, if someone came to you with those same thoughts, you would be like, oh my gosh, how can I support you? I can't imagine how this feels for you. And I think if anyone knew what it really was and understood, they would have that same reaction.
mhm. Yeah, yeah, I love that. Education for sure. And a lot of times too, I know it can help sometimes if you are in therapy. I know sometimes people will ask their therapist if they could bring their significant other into therapy for maybe one session, just so the clinician can explain certain things in the clinical terms so that they can truly understand. So that's another thing that could be potential as well as a resource. Yeah. I'll let you grab the next one, Cassie.
Sure. Um, okay, so we're getting a lot of people saying thank you, and somebody else. So a lot of other people are mentioning EMDR. So I'm definitely gonna have to look into that.
Yeah,
That might be something newer.
yeah, very interesting.
Um, Okay, so this is Haley saying, hi, Cassie and Kyle. I've been doing a little worse later with separation anxiety and washing my hands. Any thoughts? So I think this is something that definitely comes up with, you know, our OCD kind of flares up in times of stress. I've noticed, at least for me personally,
Mm,
I've noticed a lot of people changes in environment, which it sounds like this might be, or outside stressors, different things like that can make it flare up. Um, I would try to remember. I know for a fact that you went through treatment because I remember your name. So, Haley, I would suggest try to remember what your therapist taught you. Um, it is, OCD is definitely going to come and go. You might have things trigger, it might be gone forever, who knows. But it's important that we remember those skills that our therapist taught us, so that if things come up, like being separated from somebody we care about, we can put our tools that we learned into action. And of course, from somebody that also gets separation anxiety, I try to do things like call often, try to set up things to maybe ease my anxieties in that sense. But, I started keeping a journal of all the things I learned in therapy and just reviewing that whenever I feel like something flares up. So, anything that you can kind of pull out of your mental tool belt, so to speak.
Yeah, yeah, I think that's great advice, and I feel like I understand, Haley, if you've been doing maybe well and been feeling pretty good, and then all of a sudden it's like it, kind of hits this point again, and that can be scary. I know for me, I was feeling really good for a long time, and then I had like a huge trigger like a month ago, and it was the first time I was like highly triggered like that since therapy, so almost a year. And I was like, oh, it just completely threw me, like put me through a loop. And even though, like, as Casie said, I know I have all these tools, like, I've done all these things, but like that fear set in, and I just was like, oh, like I know I can do an exposure, but I don't want to because it's scary. And it's been so long that I've done exposure on this, and like whatever the case is. So I know that can be scary, but I do think that, yeah, like Casie said, I think that you have the tools, and like you know what to do, but maybe it's a little scary because maybe it's been a while since you've had to really apply those to something harder.
True.
Yeah.
Yeah. I see a really good question. Can compulsions just be mental? Yes. Some people don't have any physical compulsions, but that doesn't mean that they're not suffering with them.
Yeah, I don't have any physical compulsions. And actually, this is a great question, Paige, because I think this is kind of where like Pure O kind of started, is when people were thinking that because they didn't have physical compulsions, that it meant that it was like, that's where Pure O came from, purely obsession. So essentially purely obsessions without compulsions. But typically that's not really the case because they're mental compulsions. And so I know, yes, with me, all mental compulsions. Just to kind of give an overview, I mean, there's rumination is huge. And rumination can be really, I mean, it can encompass a lot of stuff, but essentially it's trying to figure something out, essentially. And that could be utilizing any type of information that you have in your head, memories, dreams, future thoughts, anything like that. Okay.
Yeah, some people do things like, even if you're like mentally trying to review something that happened in the past, that is a form of mental compulsion. Like Kyle said, ruminating, thinking back on events, trying to remember how certain things were. Sometimes people ruminate for the future, try to predict things that can happen, which, usually we predict worst case scenario. There's so many ways that, even our physical compulsions tie in with mental compulsions. There's a whole spectrum of things.
Yeah, it can be scary. And I think that this is a great question, Paige, just because most people don't know that there even are mental compulsions. To be honest, before therapy, I was like, I don't have compulsions. Like literally, I was like, I don't have compulsions. And when I got into therapy, my my therapist was like, well, this, and this, after I explained just my thoughts. And I was like, okay, I understand now that all that checking and researching and ruminating was all compulsions. So yeah. And I would say though that those can be harder to identify, and that can be scary, because I would say, like, if I had physical compulsions, I could very easily say, I touch this all the time. I have to do this. I have to walk through that door. Like that you're physically doing those things. Mental's hard because it's like that rabbit hole. And I mean, half the time I didn't even know what I was doing or what I was thinking about. I just know I was looking for something. So yeah, very scary, but absolutely.
Yeah. I'm even reading from other people in the comments. Sometimes people have even mental compulsions where they have to repeat certain words or numbers in their head. People may have to repent in their head. Lots of different things. So it really, for people asking if is this normal, is this common, chances are, as scary as it is, if you're experiencing it, somebody else out there is too. And that used to be my saving grace before I got into treatment. I would, you know, categorically always write on the app, I'm experiencing this. Is somebody else? If so, what do you do? And it's so different for everybody, but chances are somebody else has had that intrusive thought, has struggled with that compulsion. It's not as weird as you think.
Yeah. All right. Let's see
Trying to
here.
skim through and find some good ones. Yeah.
Oh yeah, I just grabbed this one here. Dawn, can OCD make some have low confidence and leery if they are not good as others in sports or school? Yeah, I mean, the biggest thing I think that OC took away from me was my confidence and self-esteem. I used to be very confident and like, walk into a room and not second guess anything really about, just who I was and what I was doing. And second OCD hit, those intrusive thoughts, that was out the window. I felt like I was no one. I didn't deserve to be confident. So yeah, that was my experience. I think that a lot of people with OCD experience that. What do you think, Casie?
Yeah. So, first part of the question, can OCD, whatever? Yes. If you're feeling like it's causing you some kind of doubt or, whatever it may be, there's a chance OCD has made it happen to somebody. So, but I would say personally, yes, this is something that happened to me too. As far as like confidence, I know that my OCD made me, especially with my relationships, making me question so much with my friendships. It really does take your confidence away because you lose doubt in yourself, or you lose confidence in yourself. You doubt things all the time. And in a sense, if you can't have trust and confidence in yourself, it does overflow into things like sports, school, friendships, relationships, all those things. And it's something that, even as I was working on my OCD, I had to work on my self-confidence too, and not let these intrusive thoughts and doubts cause me to think otherwise about myself or the people who care about me. So can OCD do this? Absolutely, but there is ways that we can work through it.
Yeah, absolutely. I see another really great question here from Paige. How do you balance positive self-talk with self-reassurance? What's the difference? I want to tell myself I'll get through this and I have the power to overcome this. Is that reassurance?
That's hard.
This is a great, great question, Paige. And I think that's something that I know I struggled with at times. But you made a good point actually earlier, Casie. You said that a lot of times like reassurance like comes from a place of urgency. And that's something that I think about a lot, is that urgent feeling of like, do I have to urgently tell myself like everything's going to be okay and I got this? Because that sounds like reassurance. Now, if you're like, this OCD sucks, but I know I'm going to get into ERP and I'm going to do this. I'm going to overcome this. I don't find that to be reassurance. I find that to be assurance. So that's kind of something that we talk about, is the difference between assurance and reassurance. Reassurance is harmful, comes from a place of urgency and distress. Assurance is yes, kind of like you said, more of like a positive self-talk, like a little pep talk to yourself. What do you think about that, Casie?
Yeah, I love this question. I had somebody actually message me on Instagram the other day and bring up even something like the difference between ruminating or sitting with a thought. It's so similar and it's hard to tell the difference, but I think exactly that, trying to recognize what the intention is. If you feel like you have to do this or else your OCD is going to take over, chances are it's a compulsion, but you still need to give yourself that positive self-talk. Different things like, there's one hand, telling if you need to check something and telling yourself, I can move forward without checking this. I can trust that this might not be perfect, but I can live with that and I can move forward. I can do this. That's something that might be like positive self-talk. But if you try to tell yourself, something that it sounds like you're reassuring your worries, then, for whatever your intrusive thoughts are, like if you're, say, for a simple example, you have contamination OCD and you keep telling yourself, my hands are clean, my hands are clean, that's kind of self-reassurance. So, it's definitely a fine line, and you have to learn to recognize that for your own intrusive thoughts and what your themes are. But definitely want to practice positive self-talk. So if it's something you feel like you need to do, chances are it's self-reassurance. But don't forget to celebrate the little wins that you're doing and recognize that you're putting in all this work to feel better.
Yeah, and that's actually it's just funny that you asked this question, because one of my biggest piece of advice to people going through therapy, and sorry about the noise, with OCD, is that self-compassion, because like someone said earlier, and like we talked about, OCD just takes away that self-confidence. So it's very easy to talk down to ourselves and to be like, you suck, you just thought that, how could you think that, how could you do this, you did that compulsion, you know better. Like, those are all very easy things to do that I did all the time. And I learned that that's not okay. It's not okay to really talk to yourself like that. And we need to be like, you got this, you got this, Kyle, you got this, Casie, like, kind of tell yourself that in your head. And I think that that's a positive thing, but it is confusing. But I do think as you move forward and you learn more about OCD and what you truly experience in regards to those compulsions, I think that you'll get better accustomed to what to look out for. And Casie, I actually did want to mention this because I love that you brought it up, is like the difference between rumination and sitting with a thought. Because this is something that I had to think hard about, because someone asked me this the other day on a call, and I was like, how do I explain that? But then I feel like I explained it pretty well, and I want to see if you agree. So to me, with like sitting, so I have harm OCD, so I'm scared of knives. So say I'm scared that I'm going to grab that knife and stab myself. So that's the thought. The thought is that I can grab that knife and stab myself. So that's the thought. Now, rumination for me would be like, well, why would I do that? I don't want to do that, but like that would really hurt. But like I was holding a knife 2 weeks ago, and I didn't have that thought. So why do I have that thought now? And I just was watching a scary movie, and they stabbed that person, and that didn't make me feel any type of way. And so that's like rumination. Now, sitting with a thought would just be like, yeah, I could pick that knife up and stab myself. Yep, I could pick that knife up and stab myself. Like that's sitting with the thought and rumination. Do you agree?
That's a perfect explanation. Literally sitting with a thought and ruminating. When you ruminate, you're trying to find a meaning behind it and trying to figure out why you're having that thought. And sitting with a thought is literally just that. You're not trying to figure anything out. You're not trying to assign meaning to it. It's just sitting with it. That is a perfect example.
Okay, good. I'm glad that you agree, because
I'm gonna mentally store that.
Yeah, but it's tough, and that's another great question. So I just that brought up with your question page there, it's confusing. So now I just want to say we have just a couple minutes left. So Casie, I don't know if you want to pick one more, and then I can pick one more, or
let me look and see if I see a really good one to end on.
And I'm sorry, everyone, if we didn't get to all the questions. We really try our best. Oh, actually, it's hilarious. This, not hilarious, but the last person here, which we didn't even see, he said, "What's the difference between ruminating and sitting with a thought?" So, perfect.
I do see one that's I would like to touch base on. Emily says, "I battle with intrusive thoughts, and sometimes they seem so loud. It feels like people can hear what's going on inside my head. I was wondering if this is a symptom of OCD." So the thing that's standing out to me here, and I don't know if that's a symptom or not. I think that's definitely something that a clinician would have to understand fully and be able to give you an answer for that. But in my opinion, I've had experiences like that too, where I was thinking about something, I would have those internal feelings and I was ruminating, I would like kind of space out and I would start to think, oh my gosh, people know, people can tell. Feel like somebody's watching over my shoulder. And I think that was something that I learned, was a feeling that if I had to resist doing a compulsion and sit with that feeling, that was something I also had to sit with, was somebody might notice that I'm anxious, and that's okay. That's something that also helped as I opened up to people about my OCD. I know that I used to sit and try to hide doing compulsions, and, I felt shameful about it. But as I opened up to people, yes, they might have recognized a little bit more, but they were also able to support and help me. So, you might feel like somebody is noticing it. Chances are they might not be, but if they are, if they know what you're struggling with, they're going to support you. Nobody's going to make fun of you or laugh at you. I kind of try to remind myself, if one of my loved ones was going through this, how would I react? And it's, not to reassure you, but that's another way to look at it. If perchance somebody could hear what's going on inside your head, they might not assume the worst. They might want to help you.
Yeah. Yeah, I agree. I think that there's a lot of symptoms of OCD, and I truly believe that there can be any, like, to be honest. So that's just what I truly believe is when a lot of people ask, like, well, what about that? What about that? I'm always like, I think anything can be associated. Like, obviously we're not clinicians and we can't say for sure, but
Mhm.
the brain and the mind does some wild things.
Yeah.
Overall. So especially with OCD, because we're very intelligent and very sneaky.
Yes, we're very creative thinkers.
Yes, we are. Sarah said hi. Hi, Sarah. Thank you so much. So guys, we did just hit our 1 hour mark here for 8 Central. So I just wanted to say, thank you everyone. I mean, these really, really great questions, like really. So thank you so much. And, I'm sorry if we missed a question. We will, I believe, Casie, we are going to be back next week. Is that right? So we will be back here next week. And then me and Casie are also on the app. So if you have any questions or just do want to speak to us directly, you can kind of reach out there. And I also just want to say, me and Casie are both peer advisors at NoCD, if anyone missed that from the beginning. And I just want to give a little overview of a peer advisor. So when you start therapy here, you get matched with an OCD specialist, of course, but you also get matched with a peer advisor. So a peer advisor is someone who has OCD and has been through our ERP therapy. And we're here as a support system, especially in the beginning of therapy, because we know it's scary and there's so many questions, and we're here and you can hop on a call with us, if we're your peer advisor, and then we can talk about things. So just want you to know that that's what me and Casie do. And I love doing it. I think Casie, I didn't know Casie does too. So that's just something to think about. If you're ever thinking about an OCD or anything, you do get a peer advisor as well, which is really awesome, just to have someone to talk to who understands. So me or Casie could be your peer advisor.
And the nice thing is you do have the option to talk with them before you start treatment. So if you schedule, your first appointment and it's in a week and you don't know how to prepare or what to do, you can always hop on a call with us, and we'll do our best to make sure that you feel as comfortable and confident as possible going into treatment.
Yeah, absolutely. We would love to talk with you before that first appointment, because it's scary, it's intimidating, and we're so happy to just kind of ease any hesitations. I mean, I know I was terrified before that first appointment. How about you, Casie?
Honestly, like, I try to think back myself, but my brain was like in such a fog from just the mental state I was in. But I remember being very confused. Like, I didn't know what to expect. I didn't know what I should say or what I shouldn't say. And I also had never talked to somebody with OCD, and about my OCD, anything like that. So, it's always surreal getting to talk to people and hearing that, this is the first time they've opened up, because it always feels like the first time for me whenever I talk to them. So it's a really cool feeling.
Yeah, it's really awesome. So just know that we're all here for you, and we truly are a community here at NoCD. We're all in this together. So just thank you everyone for joining in. We really appreciate it. It's been a lot of fun.
All right, bye guys.
Bye.